There we go. All right.
Okay.
I'm going to mute you guys now, okay? But I will let you guys unmute yourself if you have any questions at the end, okay?
Yep.
All right, so just to introduce myself again, my name's Melissa and I work for Community Care and I'm the supervisor of the Wellness and Exercise Program. So today we're going to talk about the body and aging, what to expect, and because it is Visual and Hearing Awareness Month, this May, we are going to talk a little bit about those changes specifically and then a couple others as well. Okay, so we'll get started here. So, some discussion topics today. There's going to be an introduction. We're going to talk about demographics of aging, changes in visual health, maintaining our visual health, and then changes in hearing health, preserving our hearing health, and then other age related health conditions, ways that we can support the aging process, and then we will wrap it up with questions. So, definition of aging. Aging is the natural process of growing older, encompassing physiological, which is our body, psychological, mind, and social, so our relationships, changes that occur over time. So, the importance of understanding aging is crucial for making informed health decisions, improving quality of life, and reducing the risk of age related health issues. It also helps us in planning for the future and ensuring better support for our older adults. So it might not even just be us, it might be, our loved ones as well, our friends, right? They might be going through that a little bit quicker than ourselves. So, demographics of aging, so global aging population. Is aging due to declining fertility rates and increased life expectancy? According to the World Health Organization, the number of people aged 60 years and older is expected to double by 2050. So that's really not that far away from us right now. We're at 2024 now. So we are expected to see quite a bit of an increase in our aging population. So it's important for us to be educated about it and know what to expect and how we can help. So, local context by 2030, Canada's aging population is projected to reach 23 to 25% from the current 18.5%. So, just even in Canada alone, we're expected to increase quite a bit in only, is that 7 years from now? Okay. So implications, aging population impacts healthcare system, increased demand for services, social support networks, greater need for caregivers, and workforce demographics, so more retirees. Challenges and opportunities, so challenges are increased healthcare costs, need for more long-term care facilities, and a potential shortage of healthcare professionals. So we're kind of dealing with that right now where we have a definite shortage of our healthcare professionals with doctors retiring, just with nurses. We definitely need more of those. So it is quite challenging for us when we do have certain issues going on and to get them treated in good timing. So, opportunities, innovation in healthcare technologies, growth in the senior care industry, and the potential for older adults to contribute to society through volunteerism and mentorship, which some of you I overheard you talking. You do volunteer for community care, so that's a great way to stay connected in the community and get to know people and help out and support others too. Okay, so changes in visual health. So normal age-related changes. So presbyopia, which is difficulty focusing on close objects, usually starting around age 40. So that's anytime we're looking at something and trying to read it up close. And we might need those readers, glasses for us to be able to see those things. We also tend to have decreased sensitivity to light. So older adults may need more light to see clearly and have difficulty adjusting to changes in lighting. And then reduced peripheral vision. So that's the vision of field that is a little bit outside of just looking forward. Even when we look forward, we can see more to the side. So that kind of closes in a little bit more. Common eye conditions, so cataracts, which is clouding of the lens leading to blurry vision. glaucoma, so the increased pressure in the eye, potentially damaging the optic nerve and leading to vision loss. So it's very important to get our vision tested for these. Glaucoma can lead to not only vision loss, but blindness as well. And then age related macular degeneration. So deterioration of the central part of the retina affecting detailed vision. And this is another one too that can really affect our vision. So we want to make sure we're getting our eyes checked regularly. Okay, I think it's usually once a year or so. And there is Vision Health Now through the government. I'm not sure the complete details, but I could always send it your way. I send it out on our newsletter, but the government is helping to, um, I'm pretty sure it's covering some of the costs, or you can apply to get some of the costs covered. So that's something to look into as well. Effects on daily life. So visual changes can affect reading, driving, recognizing faces, performing tasks that require fine motor skills. Addressing these changes is crucial to maintain independence and quality of life. So, we want to maintain our driving. And if you like to read, we want to still be able to do that. So, getting those readers, those sort of things to help you. And yeah, fine motor tasks, like anything, like beating or anything with our fingers and hands, like even holding things like dishes and that sort of thing can be affected as well. So, importance of regular eye exams. So, I've already kind of said this, but regular eye exams help detect conditions early when they are most treatable. So, if we wait too long, right, sometimes the condition is worse and then there's not as much as they can do. So, you want to make sure that you're getting those regular checkups. If you notice any changes at all, you're making that appointment or going to your doctor. The American Academy of Ophthalmology recommends comprehensive eye exams every 1 to 2 years for people aged 65 years and older. So even myself, like I have visual issues, so I can't see far. So I'm to go every year, and they do the whole thing where they check the pressure of your eye and everything just to make sure that everything is working well and there's no concerns. Okay, so maintaining visual health. So we already talked about that, regular eye exams, healthy lifestyle habits. So diet is important here. So consuming a balanced diet rich in fruits, vegetables, especially our leafy greens are very good for our eyes, and then our omega-3 fatty acids. So those can be found in like fish. You can also supplement these sorts of things too, but just making sure that you're doing that under the advice of a doctor or someone like a nutritionist or that sort of things, especially if you're on any medications, you want to make sure they don't contraindicate with what you're taking. So hydration, staying hydrated to support our overall eye health, and then weight management. So weight management, because a lot of times weight is connected with diabetes, and a lot of people that have diabetes, they have eye related issues. So we want to make sure if we are diabetic or on the cusp of being diabetic, that's regular as well, that we're just making sure that we are taking care of our eyes, but also just trying to maintain a healthy weight. So maybe joining some exercise classes or joining a walking group, that sort of thing, to help keep our weight in control. So other things you can do, eye protection. So wearing sunglasses is very important, especially now. Summer's here and the sunlight is out much longer. We want to make sure we're blocking those UVA and UVB rays from sun damage. And then safety glasses when performing any activities that could lead to eye injuries. Definitely want to make sure that's happening, and reducing eye strain. So a lot of us now, we're always constantly on our phones, right? And like a lot of times that can be really small print, even on our computers, like our laptops, our iPads, that sort of thing. So if we can, one, it's important to try to increase the text, like the how large it is, right? So if we can increase that, there's a way to increase it on your phone, And there's also a way to increase it on your iPad and also your laptop as well, so that you're not straining your eyes. And then another thing here is the 20-20-20 rule. So every 20 minutes, if you're looking at a screen, especially, look at something 20 feet away for at least 20 seconds. Okay, so that really helps get your eyes adjusted so you're not just focusing on something up really close or focusing on a computer screen, which is straining your eyes. And then adjusting screen settings to reduce glare and ensure proper lighting in your environment. So if you're someone who likes to read, at night when it gets late before bed, making sure that you have lights on so that you're not straining your eyes to see what you're reading as well. And then smoking. Smoking is definitely increases the risk of developing cataracts and the macular degeneration. Quitting smoking, it improves overall health just in general, but also eye health. Okay, so hearing health. So age-related hearing loss, known as presbycusis. This condition affects both ears and typically results in a gradual loss of hearing over time. Contributing factors can be noise exposure. So, listening to really loud music or any loud noises can damage your ears. Genetics also plays a role. So, family history can play a role in the likelihood of hearing loss. Changes in your ear structure. So, natural aging process can lead to changes in our inner ear and auditory pathways. It can affect our communication. So it makes it difficult to understand speech, especially in noisy environments, and challenges distinguishing between similar sounds. So that's a really big one, affects our communication. So I can't stress to you how important it is to make sure, if you're noticing any changes in your hearing, you get that checked out. I know those things can be very costly, but having hearing aids or something to help you with your hearing, because it really does have an impact emotionally and on our social life as well. So it can lead to, if we have hearing loss and we don't have, those devices that help us to hear, it can lead to feelings of frustration. It can lead to social isolation and decreased participation in social activities as well. Okay, so that's very important, and that can really, play a role in our quality of life, which is so important as well. So, preventing hearing health issues, so protecting our ears. So, I think now we know quite a bit about different ways to protect ourselves from hearing. So, even they recommend going to concerts and loud sporting events to wear earplugs, or like headphones. There's noise canceling earplugs and headphones now. I would say be mindful of even wearing the noise canceling, because if you're walking around and that sort of thing, you want to be aware of what's around you. But if you're sitting, at an event, you could always put those in. Just making sure that if you're going to get up and move around again, you're taking them out so that you have all that other stimulus. If someone's coming up behind you or a car is driving by, that sort of thing. So limiting exposure to loud sounds. So keep the volume at a moderate level when using headphones or earbuds. I would say even on your TV, that sort of thing. Trying to keep the volume down lower, and take breaks from prolonged exposure to loud noises as well. So, avoiding harmful habits. So, smoking and excessive alcohol consumption can negatively impact our hearing health as well. It can also just change the way we hear. Like, we might not be able to decipher what's going on around us if we're excessively consuming alcohol. Seeking early intervention. So, regular hearing screenings can help detect hearing loss earlier, allowing for timely intervention and management. And then maintaining overall health. So, a balanced diet, regular physical activity, and managing our chronic health conditions like diabetes and hypertension to support optimal hearing health. So, some other age related health conditions. So, cardiovascular health. So, age related changes in our cardiovascular system include stiffening of blood vessels and decreased cardiac function. So, some common conditions are hypertension, coronary artery disease, and heart failure. So something that we can do to help support that is getting regular exercise and not only, cardio, like walking, biking, that sort of thing, but even lifting weights can really help your cardiovascular system as well. And another really fun one is dancing. Dancing is great, right? Dancing is fun too for some of us. So dancing is another way we can get cardio and maybe sneakily get cardio too, because it does get our heart rate going, but then we're also having a good time, usually with friends. So that's a very good one. Bone and joint health. So osteoporosis and osteoarthritis are common. So maintaining bone health is essential through weight bearing exercises. So weight bearing just means that your feet are on the ground. You might be doing like a squat or lunges, that sort of thing, not lifting weights necessarily. Um, and then adequate calcium and vitamin D intake, also fall prevention strategies. So fall prevention strategies, yes, does involve exercise as well. But even just using, correct devices as we need to. So maybe, you're having some issues and your doctor or someone has recommended you use a walker. Maybe using that walker as much as you can, because usually if someone is recommending that to you, especially a health professional, it is something that can be very beneficial to you to prevent falls. Okay. So cognitive health, as we get older, some of we tend to get a little, our short-term memory kind of goes a little bit, and that's pretty mild cognitive impairment, but there's also, dementia, including Alzheimer's disease that can be concerning. So importance of keeping our brain stimulated. So social engagement does that. Maybe taking up a new hobby. It doesn't have to be a sport. It doesn't have to be exercise, anything new to challenge your brain so that, you keep learning and keep it going, keep it working. So even like a crossword or word search, or, some people like Sudoku or puzzles, like anything like that can be really good for your brain as well. And then healthy lifestyle habits. So there's metabolic health as well. So age-related changes in metabolism increases the risk of diabetes and dyslipidemia. Recommendations are healthy diet, regular exercise, and weight management. So just being mindful of what we're eating, especially sugary items. And, I know the cost of food is getting up there so much, right? So it is more expensive, I think, to eat healthier these days. But just checking maybe what's on the labels, and if there's really high sugar in those things, maybe finding an alternative. Okay. Because unfortunately they sneak sugar into all those packaged items somehow. And then our skin health. So decreased elasticity, thinning of our skin, and increased susceptibility to sun damage. So we want to make sure we're using sun protection. So, especially at the high peaks of UV rays, which is usually from about 11 a.m. till 3 p.m., I'm pretty sure, during our summer months. Maybe wearing something to cover your shoulders, a nice sun hat. Those things are in these days. So, those are really helpful as well to protect our face, which is most exposed all the time. Skincare routines and regular skin checkups. So if you notice anything abnormal on your skin, some sort of growth, definitely make sure you're getting that checked out by a healthcare professional as well. Okay, so we've talked about this already. So healthy lifestyle choices are so important to help support us as we age. So maintaining again a balanced diet, trying to get a lot of vegetables, fruits, those sort of things in our diet, and maybe staying away from, too much sugar, like pastries, bread, those sort of things. I mean, definitely getting carbohydrates is still important, but just being mindful of how much you're consuming in those things. Drinking water throughout the day. I know some of us are a lot of us have like that. We drink tea or coffee throughout the day, but 1 cup of coffee or tea, if it's caffeinated, you have to drink 2 cups of water to rehydrate yourself from that. So it's very dehydrating, caffeine. So we want to make sure we're even drinking more, like 8 to 10 cups of water a day is what's recommended. So just think, oh, how many, cups of coffee am I drinking a day? Maybe I need to balance that out a little bit better so I'm staying hydrated. Especially in these hot summer months, we want to be mindful of that as it gets hotter. I mean, even today it's 34 degrees out. So maybe carrying a reusable water bottle or even a plastic water bottle that you want to keep refilling, right? There's lots of places that will refill your water for you. So if you're driving around or out and about for the day, you can ask them to refill it. Adequate sleep. So, 8 hours is important to get. Avoiding harmful habits like smoking or drinking excessively. Social engagement and mental well-being. So coming to things like this, right? Getting out with your friends, maybe meeting new people. Maybe you go out for coffee or water after this, and you talk about what you learned today. So it's kind of sinking in a little bit, because I think the more we there's a lot of information thrown at us sometimes, but if we're carrying that on and teaching someone around us or talking about it, it stays in our brain a little bit better. Okay. And then participation in social activities, like new hobbies, old hobbies, new hobbies, and lifelong learning opportunities. You're never too old to keep on learning, right? Even if it's just a simple new thing that you do. Um, there's those health series coming up, which are going to be great ways for connecting and new information. And then, of course, it sounds like quite a couple of you are familiar with what we provide at Community Care. So, Community Care also can provide you information. Like, we talked a lot about hearing and visual health today, and I don't have necessarily a list at my hands, my fingertips right now, but Community Care can help, provide you that information. If you're kind of stumped, like, where do I go? Community care is a really good avenue for anyone, not just yourselves. So, to provide information to you about local organizations that can help you and find the right service for you. Of course, we have our transportation, which is very important, especially for getting out for, our medical appointments, but also our social things as well. Meals on Wheels is always a really good alternative to our cooking if we're, bored of cooking the same thing, or if you are like, I just don't feel like cooking. You can stack some of those frozen meals in the freezer and pull them out when you still want to eat healthy but don't feel like cooking. We have our diners clubs that are great ways to get out for social interaction and which reduces loneliness, but also there's usually some element of fun activity or information session there as well. We have our health and wellness program, which is what I run. So our exercise and falls prevention classes that are offered to you free of charge, which is amazing. There's not much we can get for free these days, and again, our health is so important. So even just coming and having fun, they're great groups of people. You meet so many new people, which is great for our mental health as well. We have these sessions, these wellness webinars where we, do a little information and learning. So that's another way for you to keep your brain going as well. Home and help support. So things like housekeeping, yard work, minor home repairs to ensure that we have a safe living environment. So they say that our living environment, even though, it's our own comfort zone, sometimes it's the place where we can have the most falls or have the most accidents. It's kind of like driving where, accidents happen closest to home. It's that route that you're comfortable with. It's what's familiar to you. It's kind of the same at home. We get used to our own home. We get used to tripping over that rug all the time, or, stepping over that maybe loose board in the floor or that sort of thing. We get used to kind of just making things work. But sometimes, having someone else come in and take a look at your home, a friend, a loved one, and seeing that you're tripping over that all the time, maybe encouraging you to maybe, get that fixed. making it a little bit safer for you. And then we have our hospital and safety at home, which, if any one of your loved ones or yourself ends up in the hospital, we do have some programming that helps support people coming home from hospital as well with community care. It's called Home First. And we do have our medical equipment and that sort of thing as well. So, summary: preventative care, regular screenings, and chronic condition management. So, chronic health conditions, managing those are crucial for our health. Community care, Peterborough supports this with essential services like transportation, Meals on Wheels, and our wellness programming. And we do just want to thank you all for coming today and your support. And again, if you have any, you think, oh, I do need to go get my hearing checked or that sort of thing, we don't provide that service, but we can help connect you with someone in the area that would. Okay, so it is time for questions. So I'm going to get Deborah to unmute you guys. And then if you have any questions at all, you can let me know. Hello.
Okay. Hello.
Do you have any questions at all?
Yeah, hi Melissa, Sandy in Lakefield. Could you go over the 20-20-20 vision thing again for me, please?
Oh, yes.
20 minutes, yeah.
So every 20 minutes, look at something about 20 feet away from whatever you were maybe staring at.
Okay.
For 20 seconds.
Okay.
Just kind of refreshes your vision.
Okay,
especially
gotcha.
if we're reading or concentrating really hard, right? Mm-hmm.
Okay, thank you.
You're welcome. I can always send this PowerPoint presentation. Lori usually asks me to send it, so if you are interested in that, I can do that as well.
Yeah, I wouldn't mind a copy. I'll ask Lori for it. If you'll send it to her, that'd be great.
For sure.
Thank you.
You're welcome. So I was going to share with you, and I'm glad I got it just in time. So I was at a wellness or a health expo last week at the gardens at Empress Gardens, and there was amazing local organizations, and so they were giving information and that sort of thing. And there's this program, where is it here? It's called, oh gosh, there's a lot here. So it's for visually impaired or people who may be partially or fully blind. And it's a service that they have, it's a group of volunteers that runs this program. And they support, people who are new to losing their vision. They have different products on hand to help support people with visual deficits. So it could be things to help you, your things in your kitchen. Maybe you label them and it reads it out to you, or it could read stories to you, like that sort of thing. Yeah, different things that people would need if they, have limited vision or that might even be blind. And they also have a group that meets up once a week and they go bike riding. So they're paired with someone who has their vision and that is familiar with biking, and they lead them in. I'm not sure how far they go or anything like that, but they go for a bike ride.
What's the name of the group?
I'm just trying to pull it up. I just got sent a bunch of information here, and it's one of these. Hearing, no. Oh yeah, and there's this as well. This is not what it is though. There was something else here.
I'd also like the phone number if you can find it, Melissa.
I know. I'm sorry.
Well, you're looking. I know you're looking for stuff.
I am, and I don't think she sent it. No. I asked her specifically for that one. Or is this it? I think it's okay. Mobile Eye Clinic. Is this the one here? Canadian? Yes. Okay. They're called Canadian Council of the Blind. So CCB is the acronym. They don't have an office location or anything here. They're a group of volunteers that run this themselves. Okay. And the phone number, toll free, is 1-877 304 0968. I do have an email address here if you're wanting that as well.
Yeah, I'll take that, please, Melissa.
Okay, CCB at ccbnational dot
Okay, CCB
ccbnational
at CCB National, okay?
.net.
Great, thank you.
You're welcome. So they call it a library. They have a library of different equipment that someone who is visually impaired can use. And if you
Okay,
they loan it to you, I don't think there's a charge to it. They just ask that you return it when you're done with it.
fair.
And
Okay.
then there was actually something else I wanted to share with you as well. If I can get this off my screen. And then there is hearing care counseling program. So it's through Canadian Hearing Services. And their phone number is 1-866 518 40 extension 4294. If you're interested in that. Did you hear me?
Yes.
Okay. And that's Canadian Hearing Services. And they offer understanding of hearing loss, use, care, and maintenance of hearing aids and other listening systems, preparing for and managing difficult listening situations, selecting home and safety equipment such as amplified telephones, alarm clocks, television accessories, and alerting devices, and more. Yeah. And it sounds like they have free consultation and services there as well. Yeah. Do you have any other questions at all, or?
I don't.
That's okay, Sandy.
You mentioned community care helping with a transfer or transition. Transition from hospital.
Yeah.
Yes.
Yeah.
So my aunt at the moment is in hospital. She's cracked her kneecap, had a surgery. She can't go home. So
Yeah.
they're looking for respite care. Does community care help with that transition, or is that somebody else?
So that usually first it goes through. So first the person has to be assessed for a respite, and if they're deemed they need the respite, I used to work in a hospital, so this is how I know how this works.
Okay.
And I worked with the Home First program. So first they're assessed to see if that's a need for them, like the hospital or the hospital staff. And then generally what happens is home and community care support services. So HCCFS, they used to be called the LIN. They used to be called
I think they're still called the LIN, because I've heard that. Yeah, heard that.
Pardon?
I think are they still called the LIN? Because
No.
Okay.
No,
They
they're
still
home and community
though.
care support services, but their sign still says the LIN, at least the last time.
Okay, that's why.
So they're not called, anyways, it doesn't matter, but they have nurses that work at the hospital on all the floors, and they go in and assess that patient to see if it's needed in the home. And then they usually go and they see if there's a provider that they can get to offer the respite. Sometimes what's happened, if they can't get all the respite covered by home and community care support services, that care coordinator, they're called care coordinators, they'll call us, our Home First representative, and ask us if we have any availability to provide respite. So we do provide respite. It's minimal of one person assist. They can't need two-person assist. There's other workings as well. They're only available at certain times of the week and during the day. So again, it depends on if we have something available and if it's required through that care coordinator that we would put that into the homes for people. But short answer, yes, we do. There's just a process, of course, like everything.
Okay.
Yeah.
Well, I'm thinking I think my cousin has said that the process has started, but he did use the word Lynn.
Yes, because I think they still refer to the Lynn because one, it's confusing. Community care, Peterborough gets confused with home and community care support services all the time.
It's right here too,
right?
Home and community care support.
But yes, they are HCCSS. And they provide all the services in the home after assessment, of course, if that person is eligible, things like nursing, things like PSW, physio, occupational therapy. I might be missing one, but those services, that's what they do. And it's home from hospital, but it's out in the community as well. They also help people, they manage the long-term care assessments and getting the beds. Like they organize the bed offerings and those sort of things.
But that's if your aunt needed a bed in long-term care.
That's where it will eventually happen.
But they don't necessarily have to be staying there, just staying there while they recover.
Yes.
There's a couple home long-term care in Peterborough that offer that. Yeah. I can't think of the name of the place. It's on the Lansdowne at no, just this side of Brayley. This
Applewood.
Applewood.
Yeah.
And they have rooms that they
Okay.
have
Yeah.
specifically for
Applewood
respite.
there's a lot of homes in the area that offer respite. You pay, but it is another option to look at is going there for respite as well. Like sometimes people that are, know that they're having surgery coming up, and if they maybe aren't, doing so well on their own or they don't have family to help support them, there's a few in the area. There's a couple of the Garden homes that does it. Peterborough Retirement Home does it. Applewood does it. My grandma stayed there actually after hip surgery.
Lakefield will do it too because my sister was there for a week.
Okay. Yeah. Yeah.
All right. That's good to know. Thanks, guys.
Yeah. Thank you. I know it's so much information sharing, right?
Mhm.